work hard, play harder. So I definitely think that I'm able to do that in this program.
How much of a family everybody is really was something that drew me to the program.
We're here at my house for a welcome party for our pediatric interns.
I think having social events outside the hospital is going to be really helpful.
They emphasize the interacting outside of work, but also you get to build those relationships so that if you do interact at work, you already know them and you can work with them a lot better.
My favorite thing about this event is really just watching our interns get to know each other, to get to know the program, to get to know the city.
I really like the city. There's a lot to do, and it's pretty manageable. It's pretty affordable.
I have always said that Louisville has everything you could want out of a city without being like overwhelmingly big.
I guess it is big for the state of Kentucky, but it feels still small. I feel like I know a lot of people.
We bought our first house here, so it's a great cost of living. There's so much to do.
I like to eat. It has a variety of foods.
Here in Louisville, there are a lot of local restaurants. I think that just is, you can't even probably begin in 3 years to even mark off half of them.
I hate being indoors all the time, which is pretty unavoidable with our job. So it's nice kind of getting outside, having some other options.
As someone that has 2 kids, it's a great place to raise a family. There's always things to do with my 2 kids.
Additional things that we offer within our program that you might not necessarily find everywhere are our distinction tracks. So we have distinction tracks in global health, advocacy, medical education, research, and breastfeeding medicine.
So we are here at the Smoketown community event.
There's a wellness center here that focuses on providing care to a historically underserved community in Louisville.
We want to learn more about our community, so one of the best ways is getting out here and being involved.
We have so many faculty with a diverse set of interests. So our faculty are interested in everything from community engagement to injury prevention to the policies that keep children safe.
You can know what medication someone needs, but if you don't know how to make sure that they're getting other resources, you're not going to be able to help them to live well.
Because maybe it's the first time I got to talk to a family about injury prevention outside of a clinic room.
We trace the origins of our global health programs all the way back to the 1990s, to the fall of the Berlin Wall. And our focus now is on a Louisville sister city in Tamale, Ghana.
I actually got to travel to Tamale, Ghana recently with our global health division, where I got to work alongside and learn with residents and physicians.
We became the 15th U.S. academic institution to join AMPATH with a focus and leadership role in pediatric engagement. We send 4 to 5 teams a year of faculty, residents, fellows.
Learning cultural differences and how, in general, cultural differences affect ways of life, affect decision making around health and welfare and medical decisions, I think makes me a better doctor.
There's a real opportunity for professionals to come alongside and support mothers. And some of the first voices they ever hear are pediatricians.
We in pediatrics promote breastfeeding, but we don't have a lot of formal time and energy devoted to it.
We do quarterly journal clubs, we have invited speakers, skill sessions, things like that, to really equip our residents with the skills needed to help their patients and families.
I have, along with a few of my attendings, taken on a project to implement the American Academy of Pediatrics breastfeeding curriculum into our newborn nursery rotation for our interns.
Everyone always talks about the people, and that's being really important, but I think also, some place that you can have a little bit of fun when you do get some free time is also really important.
It's about your ability to advocate, to outreach into the community, to develop great communication skills, to learn about global problems.
I think my class especially is pretty close, and also how close we've gotten with the attendings.
Our residents are learning not just the nuts and bolts of medicine, but all of those other skills of being a physician.